Hello everyone, this is Dr. Nanya. Welcome to my channel. In today's video, we'll be talking about ABG test, that is arterial blood gas test. Before beginning the video, I'd like you to subscribe to my channel so that I can share all the valuable and useful information with you. First of all, let us know what is ABG test. ABG test, also known as arterial blood gas test, measures the amount of oxygen and carbon dioxide in the blood. It also measures the levels of acid and base, that is, pH levels in the body, which is usually normal in healthy people. You may get this test if you're already in the hospital or if you have severe injury or illness. This test usually tells how well your kidneys, heart, and lungs are working. The results usually come along with the test. Each and every cell in our body needs oxygen to survive. Every time we breathe in, we push in the oxygen, and every time we breathe out, we exhale the carbon dioxide. This moving in of oxygen and pushing out of oxygen is known as gas exchange. This process is very important for the cell survival. If you are having difficulty in breathing, your doctor may also order this test. Now let us know why is this test required. This test can be done to check the severe lungs or breathing problems such as COPD, asthma, and sleeping apnea. This test also helps in monitoring the effectiveness of the lung treatment. It can also be done to check if you need extra oxygen or not. This test is also required to check the acid-base balance. It can show if there is too much of acid in body due to kidney failure or if there is any complication of diabetes known as DKA. Now let us see what happens during the test. For this test, a small amount of blood is withdrawn. But unlike others, for this test, the blood is withdrawn from the arteries and not the vein. And because the blood is being withdrawn from the arteries and not the vein, it may be a little bit more painful because arteries are deep in. The blood sample can also be collected from the arteries of the wrist, in the groin region, or the arm. Before withdrawing the blood, your doctor might do modified Allen's test to check the flow of the blood. So, how can you prepare for this test? For this test, you must inform your doctor about all the medications, vitamins, and supplements that you are taking. If you are in an oxygen therapy, then you might need to stop taking oxygen for 20 minutes. It might feel a bit uncomfortable in the beginning, but later it would be okay. So, are there any risks or side effects in your test? This test requires withdrawal of the blood. There are no major side effects, but make sure the needle is sterilized and the area is well cleaned. Now, let us talk about the results. The results for this test are very quick. They usually come within 15 minutes of the test. This test is not a diagnostic test. It means it alone cannot tell the doctor what the problem is. The results can tell if you are getting enough oxygen or not, if your lungs are exhaling enough carbon dioxide or not, if your kidneys are functioning well, and if you have any serious infections. For diagnosing any condition, you would require additional tests. Your final diagnosis would be based on your ABG report, other additional tests, and your medical history. After interpreting all the test reports and the medical history, your doctor might talk with you to develop a treatment plan that works best for you. If you have any questions or any suggestions, feel free to comment down below. Till then, stay safe and stay healthy.